Hi, I'm Tad Wanveer. I specialize in CranioSacral Therapy. I'm often asked two questions. What is CranioSacral Therapy and how does it work? What is CranioSacral Therapy? CranioSacral Therapy is a light touch manual therapy that focuses on improving the structure of the body, in particular the central nervous system, so that the body as a whole can work at its highest level. How does craniosacral therapy work? We can think of the body as an interrelated and interwoven biological fabric, so that if any part of the fabric is twisted, pulled, imbalanced, it will affect the entire body in some way. Here's a drawing of the body. We'll dissolve the front part of the body, and now we'll see the body as though it is fabric. Let's see what happens when a portion of the fabric is twisted. Notice that the twist affects the local area, but it also twists the entire fabric in some degree. Now we'll look more closely at the central nervous system. The central nervous system is surrounded by the craniosacral system. We'll see the body again. The body fades, and we see the skull, the spinal column, the sacrum, and the coccyx. We'll now fade those, and within those bony structures is the craniosacral system, which we're looking at now. Now we'll fade the craniosacral system, and we'll see that it houses the brain and the spinal cord. Everything we feel, think, remember, or do is processed through biological structures. When a structure is overly strained, then its ability to do its work efficiently and fully is often compromised. This can lead to ill health. As an example, let's look at an enlarged section of the body showing some of the structures as an interconnected biological network. Notice the shoulder stress that has taken place. This can lead to conditions such as difficulty breathing, frozen shoulder, bursitis, tingling or weakness in the hand or arm. There is also a distortion of the craniosacral system surrounding the spinal cord. This can cause stress to the nerve roots and spinal cord tissue that can lead to difficulties such as chronic pain, lung congestion, or difficulty swallowing. As the pattern progresses, it's affecting more of the spinal cord, perhaps causing trouble speaking or moving the tongue, temporomandibular joint syndrome, ear congestion, or ringing in the ear. The craniosacral system encasing the lower part of the brain is also affected. This can lead to conditions such as difficulty moving, migraine headache, chronic stress or fatigue, or constipation. Now more of the brain is affected. That can cause issues like difficulty seeing, concentrating or planning, poor memory, or hypersensitivity to sound, touch, smell, sight, textures, or temperature. The focus of craniosacral therapy is to use light, gentle methods to help the body lessen structural strain, so that our biological network can work at peak levels. This helps to improve our ability to heal and function fully at our optimal level. It's been a pleasure sharing this information with you. If you have any questions, please visit my website at CarrieCenterCST.com. Thank you.